My name is Marianne Williams and I'm a specialist gastroenterology dietitian. This webinar is designed to give you information on when the low FODMAP diet might be useful for a patient with a stoma. And to give context to this webinar, I'm lucky enough to be joined today by Olivia Madden, who had a stoma fitted following cancer surgery in 2013. Her honesty and clarity will help patients to understand the real world experience of using the low FODMAP diet if you have a stoma, and whether this is perhaps something you wish to try. We will start now with Olivia giving us some background to her experiences of living with a stoma.
I work with cancer patients. In theory, I knew about stomas, but actually it's very different knowing in theory and actually having one. Sort of received wisdom as you talk to your stoma nurse. The stoma nurses are brilliant, but they're dealing with people who, just been diagnosed, are getting used to it. They've only got so much time. And once you're out of the hospital, nobody ever asks you how you're getting on with your stoma. If you go to the GP about something else, never occurs to anyone since you've got a stoma to say, well, are you okay on that front? So you're a bit out on your own. I think, like many people who at the beginning of trying to deal with a stoma, when you actually don't understand either your gut, and your gut is also getting used to this new system, I would have terrible accidents. Having thought about what else could help, I suddenly thought perhaps if I can modify my diet in a way that I don't understand, I must find somebody who understands about the gut.
Having decided that she wanted to look at whether dietary changes may help her symptoms, Olivia then sought help from a specialist gastroenterology dietitian who suggested the low FODMAP diet. Before we hear from Olivia again, I'd like to explain what the low FODMAP diet is and how it might actually be relevant for some patients who have a stoma. So let me explain what FODMAPs are. Well, the word FODMAP is simply an acronym: fermentable oligosaccharides, disaccharides, monosaccharides and polyols. Bit of a mouthful. I wouldn't worry about that too much. But fundamentally, FODMAPs are types of carbohydrate that some people don't digest well or absorb very well. Not all FODMAPs behave in the same way in the gut. So there are two particular mechanisms that we see with particular FODMAPs. So some FODMAP foods can increase the amount of water that enters the small intestine. And of course, if you've got more water entering the small intestine, there's a much higher chance that you're going to have loose stools and urgent stools. And the types of FODMAPs that can cause that are things like polyols, disaccharides and monosaccharides, things like lactose and fructose. The second mechanism is that FODMAPs can be indigestible, leading to their fermentation in the lower intestine. And this can result, this fermentation, this sort of gurgling fermentation, like a fermentation factory going on inside your abdomen, can result in wind and bloating and abdominal pain. And this particularly occurs with some of the FODMAPs called fructans and galacto-oligosaccharides. So for some stoma patients, these type of reactions to these foods can end up giving you high or very watery stoma output, or excess gas or ballooning, or cramping and abdominal discomfort. And for a lot of patients, it can give them difficulty predicting their output. So that makes work and social life and sleep really, really difficult. In your case, Olivia, how much do you feel that your symptoms that were associated with a stoma affected you?
I was still incredibly self-conscious. I wore and still do wear clothes that you can't, and absolutely not close fitting. I was terribly self-conscious about any, sort of gurgles or noises from my stoma, because I always thought that's any minute there's going to be a disaster. So there was a high level of anxiety. I do remember probably about 6 months after having a stoma, I attempted to go to the cinema, sitting on the end of the row, as everybody does with a stoma, I think, and suddenly being aware, oh my God, it's happened, and having to say to my companion, I'm sorry, I've just got to disappear, and had to go and clean myself up.
So in effect, having a stoma prevented you from going out and having a normal life?
It did.
Most of the research on the low FODMAP diet has been done in people with irritable bowel syndrome and other functional bowel disorders, rather than specifically looking at stoma populations. However, the underlying mechanisms are the same, and if we look at the success rate of patients who have irritable bowel syndrome, then those that do the low FODMAP diets, about 60 to 75% of patients will see an improvement in symptoms. And in those with a stoma, if the FODMAP diet is carefully supervised, then it can really help to reduce the wind and the diarrhea type output and make the stoma much easier to manage. This seems to be particularly the case in patients who've got a stoma now but had a previous history of irritable bowel syndrome or a sensitive gut. So once Olivia had started the diet, how quickly did she see an improvement?
After 3 weeks, I could see the difference. I began to feel much more confident. The difference was, to be absolutely practical, was that the output was much more predictable, slightly more solid, which in itself made me feel more confident that pouch would do its job. By the time I came off it, it was amazing. I mean, I would get on a bus and I would go somewhere. I think I really, kind of took off on the bus, as it were, probably at the end of the diet.
Okay, so about 8 weeks, that was when you
Yeah,
used to start believing that you might sustain this improvement.
exactly. It's confidence that it wasn't a flash in the pan.
So for Olivia, this diet had been incredibly helpful. But as a general rule, we tend to see improvements in symptoms within roughly 1 to 3 weeks. But if there's been absolutely no change in your symptoms after 4 to 6 weeks and you've been following the diet really strictly, then FODMAPs probably aren't the main cause, and you should talk to your clinical team about other factors that may be responsible. What I wanted to ask her was, did she think she really needed the support of a dietitian, or could, quite frankly, she have done the low FODMAP diet on her own without any support?
No, I think that you need to be supported. I think having a stoma is a kind of lonely business, and that actually, never mind the importance of professional advice, the psychological support of somebody who's kind of monitoring what's happening to you and is in a way cheering you on is very important. And also, when it comes to the point when you've got to the end of and you begin to eliminate stuff, I think it's very important you've got somebody you can ask if you're not clear or if something doesn't seem to be quite right.
And in stoma patients, there are several reasons why support is going to be very helpful. A poorly supervised FODMAP diet might actually lead to a lower intake of fibre and key nutrients like calcium, iron, zinc, folate, B vitamins and vitamin D. And this might be a particular concern for stoma patients who often don't absorb their nutrients as efficiently as somebody without a stoma. And we have to consider the gut bacteria as well. FODMAPs that we've taken out are actually foods that provide the food for the good bacteria in the gut. So if you're removing FODMAPs for too long, it can lead to lower levels of good bacteria. And that's one of the reasons why the FODMAP reintroduction after 8 weeks is so important. However, there are some patients, like stoma patients, who sometimes need to remain on the low FODMAP diet, and this needs to be assessed by the specialist dietitian, because for those patients, they might actually benefit from a targeted probiotic to support their gut bacteria, but this needs to be assessed properly. And also age and other health conditions, so older adults with a stoma or patients with a stoma who have other conditions like inflammatory bowel disease or celiac disease or diabetes or kidney disease. These require careful management and individualised advice for the FODMAP diet so that it remains safe and balanced and nutritionally adequate. So you really shouldn't do this diet on your own if you have a stoma. It is a specialist medical nutrition therapy, and it should be delivered by a dietitian who's got accredited FODMAP training. And it's really important to remember that the advice should be time limited in the strict phase. So when you're eliminating those foods, it's for a very set period of time, like 8 weeks. And then really important is a clear reintroduction plan so that you're able to reintroduce the FODMAPs to a level of tolerance. So, Olivia, from a practical perspective, how did you find actually doing the FODMAP diet?
I loved it. The instructions were straightforward. It wasn't so different from my normal diet. And the feeling that I was perhaps, even maybe probably on the route to a solution. No, I was completely committed on the grounds that actually maybe I can leave the house without feeling anxious.
And of course, we can never promise these things will work for every patient, but for you, it's been very successful. If you were going to advise somebody who wanted to do this diet who's got a stoma, would you have any particular tips for them about doing the FODMAP diet if they had a stoma?
I'd say you've got absolutely nothing to lose and everything to gain. Go into it with a completely open mind, because you won't know, you might not be as lucky as me. On the other hand, you might be.
For Olivia, the low FODMAP diet has been utterly life-changing. However, as we noted, the low FODMAP diet may not work for everyone. But if you've got a stoma and you're suffering in silence with unpredictable stoma output and debilitating and embarrassing accidents, then this diet may well be worth trying. Here are some sources of information, including 2 websites. And I've also put a list of up-to-date FODMAP foods on the website. So please remember, however, that it is better to do this diet with the support of a dietitian. So these resources are really just to help back you up and give you some background information. I'd like to say a huge thank you to Olivia Madden. Her experience and her ability to tell us honestly with great clarity how her stoma had affected her and how successful the FODMAP diet has been for her has been really inspirational, and I hope that you found it useful. Thank you for listening. Goodbye.